When constipation is diagnosed by your GP in your child and they prescribe a laxative, which is a macrogol laxative such as Cosmacol, Movicol or Laxido, the first thing you need to do is to clear out all the old poo. Unfortunately, giving 1 or 2 sachets a day isn't going to shift the poo traffic jam. Nice guidelines for children for childhood constipation recommend completing a disimpaction, which is the process of clearing out all the old poo, using macrogol laxatives to clear out the backlog. Kate's going to explain to us a bit more about macrogols.
So macrogol laxatives, the brand names that you might be prescribed are Movicol, Cosmacol or Laxido. And they're all the same. They're all a form of a macrogol laxative. And how these laxatives work is they come in little sachets of powder and they actually bind with water and they cause the bubbles in the water to expand so that when your child drinks that water, the water cannot actually be absorbed anywhere in the body. So that means a macrogol laxative and the water it is mixed with is able to get into the bowel and to start delivering non-absorbable water into the poo, and that actually helps to soften it and to flush it out. And the way that they work is the main reason why they are so effective and so safe to use, really, because it honestly is just water going in one end, out the other. And for that reason, they're also much more effective than your normal fluids, fruit or fibre, because they are designed to actually get into the poo and help move it along.
And it's worth saying at that point, isn't it, Kate, that actually you can't treat constipation with diet, unfortunately. A good diet with lots of fibre in can help to prevent constipation, as long as with other things such as exercise and good drinking. But unfortunately, the only way to treat constipation is with medication.
Exactly. Okay. Pairing macrogols.
Yeah, it might be helpful if you could unshare your screen a moment, just so that we can show how to do this. So I have with me today, we just want to show you the importance of preparing the macrogols correctly, is the difference between whether they work or whether they don't work, basically. So please read the instructions on the packet. The macrogol laxatives, so this is a sachet, this is actually an adult sachet of Cosmacol, this is adult. The laxatives come in lots of different flavours. Now, for a child, the amount of water that each sachet must be mixed with is 62.5 mils of water. 63 is okay, and you must mix it with the exact amount of water for this to be able to work. If you don't put enough in, or if you put too much in to start with, unfortunately those molecules can't bind properly and it's not going to do the job that we know it can do so well. So basically we'd have our sachet, so you would have a paediatric version of this, and we need to tip the sachet into the exact amount of water, okay? And you need to make sure that this is fully dissolved. I'm not going to over mix this because of the sound on the video, but basically stir it for a little while until it's dissolved, okay? I usually would let it sit for a minute or two because it just helps to make sure that it's really dissolved. And as it dissolves, it will become a little bit clearer, but it does stay a little bit cloudy too. So make sure that it's well dissolved. Once you've mixed it, you can add it to absolutely anything.
And it's worth saying, just before we get on to disguising tips, so if your child is under the age of 12, you will be given the paediatric sachet, which, as Sarah said, 62.5 mils of water. If your child is over the age of 12, they will be giving the adult sachet, which is 125 mils.
Yes,
sachet.
Also awful lot easier to measure, but yes, it is. Yeah. So yeah, as I was saying, you can once you've mixed this up, and it's starting to go a little bit clearer now. Difficult to tell, I haven't mixed it very well. You can add lots of different things to it. So you can add it to some squash, you could put it in a smoothie. Hit me with ideas, Kate, because my mind always goes blank here. Jelly, lots of people use it to make jelly. You can't heat the actual laxative, but you can add it to hot or warm things. Anything else that we can add it to? Food?
Yes. in general, the colder it is, the more normal it tastes, and the less likely your child is to actually notice it. So you can make it up, pop it straight in the fridge. You can give salty crisps before your child drinks it, because the salt may help to disguise the saltiness in the electrolytes, which are in the macrogols.
Yeah, so there's no salt in the macrogols, but there's the salty slight taste to it, isn't it?
Yes, yeah. Exactly. You can use the water to make jelly, put it into smoothies, put it into milkshakes. You can freeze it. So you could freeze it into ice lollies. Yeah. You can dilute it with any juices that you like, and in general, diluting it adds to the quantity of fluids that your child will have to drink, but it does also really do its job in disguising the taste. Yeah. Very thick, kind of fudge-like chocolate milkshake is one that we heard on the helpline. Drinking through a straw will bypass some of the taste buds on the tongue. What other ones have we got? There's lots out there. Like Sarah said, really the only thing is that you don't want to, chuck it in a boiling hot chocolate. It could be added to milk and put onto cereal. There's lots of different things. Some families have also said that putting it into a different cup, or even putting it into a bottle that their child thinks they have bought from the shop, can just make it feel a bit more normal.
Yeah. And we've got a fact sheet on the website, which is how to use macrogol laxatives. So we would really recommend you having a look at this. We've got a fantastic search function on the website. So although most of our fact sheets would be at the bottom of the relevant page, so if you were going to look on the constipation page on the website, you'd find this at the bottom of that page. So what we then need, you've got all the information here, exactly how to mix it, some ideas and tips for getting your children to drink it. So as Kate said, new cups, new straws, things like that can all be really good. So yes, that could be really good.
And if anyone's come across something that works that we haven't mentioned, please put it in the comments as well. Because the best way to find out about these things is usually just doing them.
And I know that one thing that that our nurse has suggested as well is that to start with, you could start off by, and Kate's going to talk to you a bit more about giving the macrogol laxatives in a minute, but as we suggested, you could make up the day's amount in a jug. And to start with, you could just put a little bit of that mixture into a normal glass of squash, because it's going to be really difficult to detect from that small amount, and it's still going to go to their bowel, so that's fantastic. And then you could gradually increase the amount that you give, or a spoonful into a yogurt or things like that, just to very gradually get them used to the taste.
In terms of behavioural tips and strategies for helping your child drink it, taking care to explain to them in nice simple terms what constipation is and what these medicines will do in simple language that they understand is going to help them to be on board with taking them, because we do need them involved in taking them. It could be as simple as these medicines are going to help to empty your tummy and make you feel better. It might be a little bit more complex for an older child, but just make sure that your child is aware. As Sarah said, start small, especially for a child who's constipated. Sometimes these children feel really, really full in their tummies, which means that they just don't want to eat or drink. So if you start small and do lots and lots and lots of little and often, that is going to help to get the ball rolling, and then you can just build up over time. The approach can help as well. So having a drinks time routine. So it's drinks time when it's breakfast. It's drinks time before we sit down to watch TV. Is really nice. And if you're giving it in a cup, like Sarah said, start small. Teach them to finish the cup, and maybe even show you the bottom of the cup. And
that's good practice for general drinking, isn't it? Just teaching children to finish a drink. So just start with a small amount in a cup. That's really good.
Exactly. And then a nice little reward. And during disimpaction, it can be quite a hefty reward, because it is a fixed period of time. So it could be a voucher for 10-20 minutes on a bit of tech, or whatever you like, really. But yeah, doing it like that can be really, really helpful.
Okay, and how about actually giving the macrogols then? So let's have a think about how do we give them? Have you got any tips there? Best ways to do it?
Yeah, in terms of, medical and practicalities, your whole macrogol dose needs to be given within a 12-hour period, and that's it. You can give as much as you like at once. So you could have a challenge of, a couple of cups of macrogol first thing in the morning. So you can combine 2 or 3 sachets with your right amount of liquids, or you could spread it evenly through the day. As long as it all goes in within 12 hours, you're good. The only thing to bear in mind is that having, 4 or 5 sachets worth at a time might be a little bit too much for the tummy. It might be a little bit bloating.
And also, I guess they're going to be so full of liquid that they might not want much to eat. And I think it's worth pointing out that macrogol laxatives don't have a timed effect. So, and this is why we do recommend you give them every single day, okay? Because they just, the liquid will go to the bowel, but there is no set time for how long it's going to take, for you to see the poo start to get runnier and start to come out. So this is why it doesn't matter whether you have a mouthful at a time or a cupful at a time, because they still work, don't they?
Exactly. That being said, a macrogol sachet just before bedtime might not be the most ideal time. It might be better to try and get them in a little bit before bedtime. But if it's a choice between, macrogol right before bedtime or 0 macrogol, probably want to go for the macrogol. Okay, other things. So we talked about how to spread it through the day, how long it keeps once it's made up. Movicol and Cosmicol will keep for 24 hours in the fridge. And what's the other one? Laxido will keep for 6 hours in the fridge. As far as we are aware, if you freeze them, they're good forever. But we don't exactly know that. There hasn't been a test on frozen macrogols. But you could at least use those time frames for frozen. I think that's it for actually giving them. They are really simple. Really simple.
Yeah, I know we've alluded to the fact that the laxatives aren't absorbed into the body, and so we do need to point out that it's really important that your child still drinks their normal amount. A constipated child should be drinking between 6 and 8. Well, every child should be drinking between 6 and 8 cups of water or squash a day. Some milk in moderation is fine. When you're constipated, it should be nearer the 8 than the 6. And you can't include the macrogol laxatives in that figure because it's not absorbed into the body. So this is why, you can feel like you're constantly on at your child to drink your laxatives, drink your juice, drink your milk. So this is why it can be quite good to try and get some of it into their food, because at least it's not you constantly sort of saying, have a drink. But yes, it's just worth noting that. Do you keep on top of their drinking? And, because the longer the poo stays in the bowel, the harder and drier it becomes. This is why it's so important to be hydrated and well hydrated. The body's job is to absorb moisture from wherever it can get it. So if it's well hydrated, it won't need to suck as much out of the bowel. So, and we really want moisture to stay in the bowel because we don't want hard, dry poo.
Yeah. Whatever you use to dilute your macrogols won't count towards fluid intake either, or we can't count on it counting towards fluid intake. Drinking competitions, if everyone's getting really, really knackered, drinking competitions can be a good one and kind of put a bit of motivation back into the drinking schedule. But yeah, drinking is just super important, especially during your disimpaction.
Yeah. So should we talk a bit more about the actual disimpaction itself? Just thinking I could share the guide for a moment. Let's have a quick look. Okay, so on our website, you'll see, I think that's actually the advice sheet. Here we go, Parents Guide to Disimpaction. Again, you can do a search for this, and we've got podcasts on disimpaction as well. So any child that's been constipated for more than a few days, then, NICE guidelines will recommend, and it does quote this here, disimpacting with pediatric macrogol sachets. So I'll let Kate talk you through the disimpaction, but basically, again, at the bottom of the constipation pages, you will find this resource, but again, you can put it into the search bar as well.
Yeah. Okay. Disimpaction sounds scary. But as Sarah was saying earlier, it's really needed when your child is constipated. Disimpaction is the process of giving increasingly big doses of macrogol sachets to your child to drink. And those increasingly big doses are going to put more and more water into the poo. So during a disimpaction, you are going to see a lot of poo. And it's important to remember that all of that poo is not lost nutrients, it's not lost fluids, it's the macrogols coming out plus emptying the poo. And that's what we want to do. We want to flush all of that out. So yeah, you're going to see a lot of poo. In the first couple of days of disimpaction, your child might have a little bit of tummy pain or tummy cramps. You might want a little hot water bottle on side, some childhood paracetamol.
Not the same for everyone though, I think, is it?
No.
Sometimes, yeah, some do get that.
Yeah. And you want to keep going past the point of your child having really diarrhea-like poo and all the way to then passing 2 lots of brown rusty waters in a row. And that brown rusty water is your macrogol laxative coming out the end, showing you that there is no poo left. So you have reached the end of the poo traffic jam. And it's very important to get to that twice in a row because we need to make sure that it's not a false red flag. Sometimes the water can actually bypass the poo traffic jam and come out. But if we get it twice in a row, we know that's not the case. We know the bowel has definitely been emptied. So that's what your disimpaction is. It's going until you get to your brown rusty water. The length of disimpaction is really different for every child. So you'll see on our guide here, we've got, and this is the same as in NICE guidelines, we've got the doses listed up to day 6. You've got day 7?
Oh no, there is a day 7. There you go.
I'm weird on the screen. Yeah, day 7.
Yeah.
We go up to day 7. If you are not on brown rusty water by day 7, then what you do is you just repeat day 7 until you get there. And it's totally safe to do that. Yeah. For lots of children, well, there isn't really a set time how long it takes.
I guess we don't know how much poo is in the bowel, do we?
Exactly, which is why it's a bit of an experiment. And it's why it's so safe as well, because on the really, really small chance that you are wrong, that your child is constipated, all that is going to happen is that you will get to your brown rusty waters twice in a row, very, very early on. So maybe something like day 1 or day 2. So in which case, great, you've ruled it out and you can move on to something else. If you keep going, then we're seeing how much poo is in the bowel. And certainly,
so go on.
I was going to say, certainly a disimpaction of 7 to 10 days is a very, very bankable bit of information telling you your child has been constipated, because it just wouldn't take 7 to 10 days otherwise.
Unfortunately, it can take longer than that, and it is worth saying that as Kate said, there's absolutely no set time for how long it's going to take, but I think what you'll see is your child beginning to feel an awful lot better, because as we know, constipation can affect behaviour, appetite, it can cause nausea, so it really does have an impact. And I think as that poo starts to move along, you may well see some bloating, because obviously there's probably going to be a lot of laxatives in there as well as a lot of poo. So it's okay to expect to see some bloating and listen to some gurgling. You'll probably hear a fair bit of gurgling and some wind. But all these things are really, really normal. But as I said, there's no set time for how long it's going to take you. Some people, it can take weeks, and some parents and carers do choose to wait until school holidays to do it. Because so this is a good time now to make sure that you get a good stock of laxatives in if you're going to do a Christmas disimpaction. But depending on the time of year that you're watching this video, think about when you might making sure that you've got a good amount of the laxatives to do that. Also, while I remember, let me just say that some GPs will add a stimulant laxative in. to help speed the process up. A stimulant laxative works very different to the macrogols, so they can be used together. Stimulant laxatives encourage the bowel to squeeze, and obviously that helps to move the poo along, because it's the action of the bowel squeezing that makes that poo move along the bowel. And so the stimulants, they tend to take 8 to 10 hours to work. So a lot of people give them at bedtime, because then your child is less likely to notice that squeezing. It is really important that they're only given when the child has been on the macrogol laxatives for at least a week, because you need to be sure that the poo is softened enough that when the stimulants are encouraging the squeezing, that it's not moving hard poo along, because that's where you might find a child saying, you know, I've got tummy ache and it hurts a bit. But quite often a stimulant can be useful in terms of helping to move the process along, helping to shift the poo, and also can be good for sort of encouraging a toileting routine when you're trying to get back to normal.
Can I just say as well, so every child is different, but what NICE guidelines say is disimpact and just use macrogols. Macrogols more than enough for your disimpaction. There's a lot of kids out there who will never even need to use a stimulant. NICE guidelines also say if you haven't reached brown rusty water by day 14 of your disimpaction, that is when you can add your stimulant in. It's not unthinkable that it could be added in before, but what NICE guidelines say is go up to your day 14. The reason that they can sometimes be needed specifically during disimpaction is because sometimes, well, constipation is always the problem of too much poo in the bowel. Sometimes what the bowel does is it develops baggy pockets of poo, and these baggy pockets of poo they take their time to come out. So if you are disimpacting after 2 weeks and you've got sort of gravy-like poo still coming out after 2 weeks, then that can be indicating you've got these baggy pockets, in which case, under NICE guidelines, you can ask your GP for your stimulant laxative. That will get those baggy pockets squeezed nicely so they actually start to fully empty, and then you can use that stimulant laxative until you get to your 2 brown rusty waters in a row. The dose information for stimulant laxatives are in NICE guidelines, so your GP can tell you how much to give. Stimulants are known as sodium sulfate or senna or bisacodal. And like I say, we don't need to be scared of stimulants. Some GPs will prescribe them before, some parents will ask for them before. But like Sarah said, we just really need to make sure that the poo is soft, especially during disimpaction. Yeah.
Okay, so after disimpaction, can you talk us through the finding the maintenance dose?
Yeah. So when you get to your 2 brown rusty waters in a row, you have cleared out all the poo, so you've got there. After that, however, well, even though you've done that, the bowel is still going to be quite stretched. So it may have some baggy pockets, or it might still just generally be stretched, and it's going to need some help to actually shrink back and recover. So when you disimpact, you don't actually stop giving macrogols, but you do drop down to a smaller ongoing daily dose. And that daily dose you give every single day to encourage a couple of soft formed daily poos. And by helping the bowel to fully empty, that is going to help the bowel actually shrink back. And the more it shrinks back, the more tone it regains. So it can start to squeeze poo along effectively. And the more just everything gets a little bit better. In terms of finding the right daily dose, there's lots of conflicting information out there. What we say at ERIC is use your disimpaction to tell you what daily dose your child needs. I'm just going to share the disimpaction guide so I can explain that. Okay. So if we look at your disimpaction doses, a child of 1 to 5 is going all the way up to the maximum of 8 macrogols. A child of 5 to 12 is going all the way up to the maximum of 12. child over 12 going all the way up to maximum of 8. So basically, we know
sachets, yeah.
Yeah. So when you got to your brown musty waters, you have a look at the daily doses that are recommended. They're all on a sliding scale, so between 1 to 4, 2 to 4. So use your Disimpaction to tell you where your child is on the scale. So what that means is if they needed to go right up to the top Disimpaction dose to fully clear out their bowel, then you're going to want to give them the top daily dose. So that would be 4 sachets for your younger children. Or if it's sort of, if it just took you 3 or 4 days, then maybe you want to give them something in the middle of their daily dose schedule. So around 3 sachets. You can drop straight down to your daily dose. You do not need to go sachet by sachet because they don't need the high doses anymore. So you can just drop straight down. But you do want to stay on the daily dose that you choose without making any changes for a whole week. And I just say that because the bowel will often produce runny poos the first week after Disimpaction. And lots of parents can panic and think that they need to stop macrogol, but actually you do need to carry on with your macrogol. The runny poos are just they're just a case of the bowel taking time to settle down after being disimpacted. So stay on your daily dose, no changes 1 week, and then at the end of that week you should find that daily dose is doing its job, and we are looking for the daily dose to help your kid have between 1 and 3 soft formed normal sized poos every day, and you want to be staying on that daily dose for as long as is necessary. That could be 6 months, it could be longer. It's not uncommon, and it is safe to use it for that amount of time.
Okay. So you can find podcasts about disimpactions on the podcast page. So you could search in the search function, just type in podcasts, and there are two podcasts on disimpactions which you might find helpful. And again, the fact sheets that we've shown you today, so how to use macrogol laxatives and a parent's guide to disimpaction, you can search for those. You can find them at the bottom of the constipation page of the website. It's also worth having a look at the constipation page on the website as well, because there may be additional things. So there's our advice sheet for children with constipation, and it's handy to keep an eye on the poo checker when you are coming out the other end of the disimpaction, and you want to sort of be able to see where you are on that scale as to how close you are to getting that perfect poo.
Yeah, and I should say, with your daily dose, you are aiming for the poos to be really nice and soft and formed. So quite often that might look a bit like a Mr. Rippy type poo consistency. And it doesn't happen for every child by any means, but a small number of children will have a little bit of soiling after their disimpaction. Not overflow soiling, it's more like very small, soft lumps of poo passed into the pants. And don't panic if that happens. Some children do experience that as the bowel is taking its time to shrink back and recover, and that soiling will reduce as the bowel shrinks back and recovers.
Okay. Thanks very much, Kate. That's great.